more broadly for you, because the executive director of the Central New York Lyme and Tick-Borne Disease Alliance, Royale Scuderi, isn't just a professional organizer and a good one of a nonprofit. She is a living, breathing example of someone who has suffered from Lyme and another diagnosis for many, many years, 13 years and counting. Lost a lot of time at work, lost tens of thousands of dollars in trying to get properly diagnosed and eventually properly treated. And now she has made it her life's work with this alliance that is hosting this event to try and learn, as you all are, and to share what she has learned with you. So I'd like to welcome now to the podium the executive director of the Central New York Lyme and Tick-Borne Disease Alliance. This is Royale Scuderi. Royale.
I'm going to keep my remarks short so we could get to our fabulous presentations that I'm very excited about. Yeah, looking at you guys. At the start of this summit, we just want to frame the conversation with an understanding that there are differing approaches to tick-borne diseases, depending upon whether the clinician is IDSA or ILADS trained and informed, and which school of thought they subscribe to. But in daily practice, there's a great deal of overlap and blurring to those lines. We'll hear more about guidelines specifically in the conference later, but here's an overview of general IDSA, ILADS differences with a very, very broad brush. There are some specific differences in the way they approach diagnosis and treatment, but at a high level overview, in general, IDSA places greater emphasis on clinical trials, clinical testing, and adherence to guidelines, while ILADS places emphasis on case studies, clinical judgment, and shared decision-making. That's huge generalization, very big picture. It's important to point out that IDSA and ILADS physicians generally agree on some very important points. Lyme disease is an issue. The goal is to help patients feel better, and current early testing continues to be problematic. It's also important to point out, for me to acknowledge, I think, and for us to point out, that every clinician in this room is here because they want to help their patients get better. They want to learn the latest research, methodologies to better serve. But there are growing numbers of the tick-borne disease cases, and so we're all looking for answers, and I think we're all in that together. But as I said, these are just the bare guidelines. I'm not going to read them. You can read them. As our understanding of these diseases continues to evolve, the importance of clinical judgment and the need for patient-centered care only increases. Tomorrow, we'll present several very complex patient case studies with differing presentations and differing constellation of symptoms that I think you'll find very interesting. And we will talk about how two physicians from the differing philosophies, Dr. Christopher Paolino and Dr. Heidi Poots, best use their clinical judgment and experience to help these patients get better. And then we're going to have conversations and questions that'll help you all take this knowledge, add your knowledge to it, and maybe walk away with some tips on how to better serve your patients. So we're so thrilled you're here. We're going to learn so much. I'm so very excited about our presenters, the presentations that are coming. We're going to learn so much. We're all in this together, and I thank you very much for coming, and I look forward to all of your questions. In my opinion, the Q&A is the most fun part of this event, so please do not hesitate to go up to the microphone and ask your questions, and we'll have some really great informed conversations. Thanks, Dan.